Hi, I'm Olivia Sharp and I'm going to be completing a neurological assessment today. So first, I'll start by assessing their level of consciousness by performing the Glasgow Coma Scale. So I walk in, her eyes often open spontaneously, so that will give her a 4 on that. And then after that, I will assess her verbal response. So can you tell me your name
Stephanie
and your date of birth?
November 19th,
And what date is it today?
November 7th,
And what town are we in right now?
Trenton, Missouri.
Okay, so based on that, she didn't have any speech difficulties, so I will give her a 5, and she's alert and oriented. Next, I'm going to assess her motor response. So can you grab my fingers? And she's able to follow commands, so she will get a 6 on that, which totals to 15, which is a good score. Next, I'm going to observe her posture and positioning. So she's comfortable, she looks in a good position, nothing abnormal, so that's good. Her general appearance is clean, good hygiene. So then next we're going to assess her pain. So are you in any pain today?
No.
Okay, so based on her response and her expression, she doesn't have any facial grimacing, so I will not go further into detail with the pain assessment. Then I will do her vitals, her blood pressure, her pulse, respirations, all within normal limits. Next, I will assess cranial nerve number 2 for any vision deficits. So I will use this chart, and can you read this line for me?
L, P, E, D.
Okay. And she was able to do that without any trouble. Next, I will assess her hearing, which is cranial nerve number 8. And I will have her cover one ear and whisper into one ear. So,
Apple.
and then I'll do the same for the other side.
Baseball.
And again, that was cranial nerve number 8, and she didn't have any problems with that. Next, I'm going to assess her memory, her recent and remote. So for recent, I will ask her a question such as, what did you have for lunch today?
Subway.
And to assess the remote, I will ask, what did you do during Halloween?
I worked.
So there was no problems with her memory. Next, I will assess cranial nerve number 10. And based on how she's been talking, and no difficulties with that, there's no need to go further into that assessment. Next, I will assess cranial nerve number 2, 3, 4, and 6. So I will use my pen light, and I will have you just look at me. And her pupils are equal, round, and responsive to light, and they accommodate. And then I will assess her 6 cardinal field of gaze. So I will have you look straight forward at me and try not to move your head, just your eyes. And she had no difficulty with that. So we will move on to motor function. We'll assess cranial nerve number 7. So can you smile and frown and puff out your cheeks? And she had no difficulties. Next, I will do the Romberg test, which tests cranial nerve number 8. So I will have you stand up and put your arms out, palms up, and then close your eyes. And I will assess her balance for 30 seconds, making sure that I have a hold of her just in case something happens, and noting any off balance. She's doing fine. You can go ahead and have a seat. So that assessed cranial nerve number 8. Next, I will assess her gait. So can I have you walk from one end of the room to the other? And I'm looking for any shuffling, any off balance, and she had no problem with that. Next, I will assess her muscle tone, strength, and coordination. So I will have her grip my fingers. Perfect. And then I will do pedal presses, push against, and then I push against you. And they're both equal and strong, so that is a good sign. Next, I will assess cranial nerve number 5, and let me know when I'm touching you.
Touch. 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 Touch.
And she had no problem with that. Next, I'll assess cranial nerve number 9 and cranial nerve number 10, which is her gag reflex. But I'll have her take a drink of water and watch her ability to swallow. And she had no problems swallowing, so. And then I will assess her deep tendon reflexes. So I will hold out her arm and assess her brachial reflex. Okay. And then I will assess her patellar reflex. And they're both responsive. And then I will assess for the Babinski reflex, which is positive on babies but should not be positive on adults. So and in babies, their toes will fan out, but that is normal, not a normal response in an adult, and she does not have that, so that sign is negative. And that concludes my neuro assessment.